and then I will finish chapter 7. Let me let somebody else in. There you go. Can we all see that?
Yes.
Yes.
Okay, good, good. We're going to finish the axial skeleton, and then we're going to go to the appendicular skeleton. The remainder of the axial skeleton basically is your vertebral column. And there are certain things in the vertebral column I want you to know. Obviously, the vertebral column extends from the skull to the pelvis, and it's also known as the spinal column or spine. Okay? It's important because it functions to transmit the weight of the trunk to the lower limbs. It protects the spinal cord. And there are 26 bones called vertebrae in the 5 regions of the vertebral column. This is what I want you to know. I want you to know the different regions. The cervical region has 7 vertebrae. The thoracic region has 12. The lumbar region has 5. The sacrum has 1. And the coccyx has basically fused bones into one bone. So cervical, thoracic, lumbar, sacral, and coccyx. Those are the regions I want you to know, okay? And how many vertebrae are in each one. You can see here that you can remember meal times. 7 a.m. is cervical, 12 noon is thoracic, and 5 is lumbar. I don't think anybody eats at 7 a.m., but it's a nice way to remember it. 7, 12, and 5. Okay? There are many curvatures of the spine. I don't want you to know the normal curvatures. I want you to know the abnormal curvatures. Okay? This is what the normal curvature looks like. But what I want you to know are the abnormal curvatures. You don't have to know ligaments. That's not important. That certainly is not important. Okay? But what I do want you to know is that in between each vertebrae is an intervertebral disc. And in for exam number 1, you answered the question. And the question is, what are these discs made of? They're made of fibrocartilage because they are strong and they are shock absorbers. Okay? The intervertebral disc consists of 2 parts. The nucleus, which is the innermost part of the disc, and the annulus. The annulus is the surrounding fibrocartilage of the disc. So it is the nucleus and the annulus. The word annulus means ring. Okay, so it's the ring around the nucleus. And when you say nucleus, it's the center of the disc. And this is what your disc look like. Here they are, in between the vertebrae. This happens to be lumbar vertebrae, but here are the discs. Okay? This is the nucleus pulposus, the gelatinous material. When you have a herniated disc, the gelatinous material comes out. And what's this? This is the spinal cord. This is the spinal cord. Okay? And so it can impinge on your spinal cord, when you have a disc problem and cause severe pain radiating down both legs. All right? But what I want you to know more than that is the abnormal curvatures of the spine. There are three abnormal curvatures of the spine. One is scoliosis. And if you went to school in New Jersey, you were tested for scoliosis in elementary school. It is an abnormal lateral rotation of the spine, and it can lead to breathing difficulties. Kyphosis, otherwise known as hunchback. It's an abnormal dorsal curvature of the thoracic spine, and it occurs in elderly people with osteoporosis or people with vitamin deficiencies like rickets and osteomalacia. Also, lordosis, otherwise known as swayback. It's an accentuated lumbar curvature that's basically seen when someone has got too much of a belly. And you get too much of a belly when you have a pot belly or you are pregnant. So here is scoliosis, a lateral curvature problem. Here is kyphosis, a dorsal curvature. And here is lordosis, because this lady is pregnant. It kind of sunks in. So know the three abnormal curvatures of the spine. The structure of the vertebrae are not important. What I want you to know is what I will go over. I am not going to ask you any questions on the structure of the vertebrae. So I'm not going to ask you any of these questions. I think you have these questions in your lab. So take it in your lab. Don't worry about it for exam number 2. Not important. But what I want you to know is the differences between the regions. The cervical vertebrae are the smallest, C1 through C7. Remember, there are 7 cervical vertebrae. They are the lightest and smallest of all vertebrae. They have names. C1 is the atlas. If you know anything about mythology, the demigod Atlas held up the world. So C1, otherwise known as the Atlas, holds up your head. That's the importance of the Atlas, C1. C2 is called the axis because it allows your head to pivot. It allows your head to go left and right. Okay, so that is important. That is important. These 2 vertebrae have names, and I want you to know their names. And they give the head the ability to nod and say yes. So those are the important vertebrae in the cervical vertebrae. Okay? Here is C1. You'll see this in your lab. You'll see this in your lab. All right? The atlas. The axis is C2. It allows you to say no. It goes back and forth. No. Left and right. It allows your head to pivot and rotate, whereas the atlas allows you to go forward and backwards. Okay? So know the atlas C1 and know the axis C2. The thoracic vertebrae, there are 12 of them, T1 through T12. Why are they important? Because the thoracic vertebrae attach to your ribs. So that's extremely important. They attach to your ribs. The lumbar vertebrae, the biggest of all the vertebrae. They are the most massive because they have the most stress. They carry the majority of weight of your body. L1 through L5, the lumbar vertebrae. The sacrum. The sacrum basically is five bones that are fused together. And that's basically all I want you to know about the sacrum. The coccyx. The coccyx is known as your tailbone. It is also a bunch of fused vertebrae, 3 to 5 vertebrae that are fused. It has basically no function. That word very little is not really true. It has no function whatsoever. Okay? The coccyx, the tailbone. Here is the sacrum. Here is your coccyx. That's basically all I want you to know about the spine. I also want you to know about the thoracic cage. This is the end of the axial skeleton. The thoracic cage is composed of the sternum anteriorly, the thoracic vertebrae posteriorly, and the ribs laterally. It protects the organs that are in the thoracic cage, namely your lungs and your heart and other organs that are in there. Here is your sternum. Here is your sternum. Here are your ribs. I want you to know about the ribs. You have 3 kinds of ribs. True ribs attach to the sternum, 1 through 7. You also have false ribs, which basically attach to each other and then attach to the sternum. And then you have floating ribs, which do not attach to the sternum. So you have true ribs, false ribs, and floating ribs. The sternum, otherwise known as the breastbone, is composed of 3 bones. The manubrium, the superior part of the sternum, articulates with your clavicles. The body is the middle. It attaches to the cartilages of ribs 2 through 7, and the xiphoid, which is the inferior end of your sternum. Okay? And for those of you that know CPR, this is where you are told before you put your hands on someone's chest to do compressions to find the xiphoid process and then go above it to press on the body to do CPR. If you continue to press on the xiphoid process, you may puncture the heart. This is where you put your finger. This is where you put your heel of your hand when you're doing CPR. So the 3 bones of the breastbone are the manubrium, the body, and the xiphoid process. You don't have to know the notches. That's not important. And I just said this. The ribs. We talked about the ribs, and what I told you about the ribs is what you should know. The true ribs, 1 through 7, attach directly to the sternum. The false ribs, 8 through 10, attach indirectly to the sternum by joining the costal cartilage of the rib above. The floating ribs, 11 through 12, do not attach to the sternum. Here is the parts of the sternum, the manubrium, the body, and the xiphoid process. This is where you put your heel of your hand to do CPR on the body. All right? Don't have to know anything about the ribs except the three types. All right. Let's do the appendicular skeleton. Any questions on the axial skeleton before we start?
I have one question about terminology.
Go ahead. I can barely hear you. Go ahead.
Oh, I'm sorry. One question about terminology. Cervical both refers to like these sections near the head, but doesn't it also refer to like the cervix, as in like cervical cancer?
That's it. I can barely hear you. Say it again.
That cervical refers to the head and like the areas around it, but cervical.
No, it refers to the neck. The neck.
Sorry, the neck. But isn't cervical also the word for cervix?
Yes, it's the neck of the uterus. Cervix is the neck of the uterus. Yes, you are correct. Yeah, it's confusing. It's not really. It's a poor word. It's a poor word, but it means the neck of the uterus is what it means. Okay.
Okay.
All right. Good. Good. Okay, let's go into the axial. I'm sorry, the appendicular skeleton. The appendicular skeleton consists of two girdles. A poor term, but the word pectoral girdle is the upper limbs. Basically, the pectoral girdle is your shoulder, and also the pelvic girdle, which is your hip girdle, okay, your hip joint. So let's talk about, there it is. Pectoral girdle is basically your shoulder, which consists of your clavicles and your scapula. Okay? Clavicles are your collarbone, scapulae are your shoulder blades. The shoulder girdle is there to attach your limbs to the axial skeleton. Okay? It has a tremendous amount of mobility because the socket of the shoulder joint is shallow. Okay? That's the reason. And the shoulder blades are not attached to the axial skeleton. So you have a lot of movements of your arm, a lot of movements compared to your hip, which we'll talk about in a minute. This is your shoulder girdle or your pectoral girdle, okay? We'll talk a lot more about it, but here it is. Here is your clavicle, which attaches to your sternum. This is known as the sternoclavicular joint, okay? The attachment of your clavicle to your sternum. You also have an acromial clavicular joint, which attaches to your shoulder. This is your ACL. This is your ACL, okay? A common injury in football players when they are hit from behind. When you're hit from behind, this joint pushes forward and dislocates. That's why it is illegal in NFL football to hit somebody from behind. All right, it's a penalty. It's a penalty. Collarbones, clavicles. The sternal end attaches to the sternum. It is known as the sternoclavicular joint. The acromial end attaches to the scapula. This is the acromial clavicular joint. All right, and it ankles the muscles that hold your shoulder bone in place. All right. You don't have to know anything about the clavicle except the acromial end and the sternal end. This attaches to your sternum. This attaches to your shoulder blade. Don't worry about all the others. That's not important. Those are certainly not important. Dear God, that's not important. But here's your scapula. It's posterior. It's a big bone, okay? A big bone, the shoulder blade, otherwise known as the scapula. Don't worry about all the other things in it. You don't have to know that. It's not important. Not important, okay? The only thing I want you to know about the scapula is that it has a cavity in it. And that cavity is the glenoid cavity. This is where the head of the humerus sits. This is where you have your shoulder joint. This is it. It's known as the glenohumeral joint. So your shoulder joint is known as the glenohumeral joint because the humerus sits in the glenoid cavity. Okay? So now let's talk about the upper limb. The arm. The arm is known as the humerus. The forearm. The forearm has two bones, the radius, which is the medial bone, and the ulna, which is the lateral bone. It connects to the hand at the wrist. There are 8 carpal bones at the wrist. Carpal means wrist. There are 5 metacarpal bones in the palm. Metacarpals are your knuckles, and there are 14 phalanges in your fingers. The humerus is the only bone of the arm. It is the largest and longest bone of the upper limb. It articulates with the glenoid cavity of the scapula, making the glenohumeral joint. And it attaches inferiorly with the radius and ulna at the wrist. You don't have to know the structures in the humerus, not important. I'm not going to ask you anything about the humerus other than where it attaches, inferiorly and superiorly. That's not important, okay? You certainly don't have to know any of these. Not important. You will never remember it. You'll never remember it. The elbow. The elbow consists of the humerus superiorly and the radius and the ulna inferiorly. Okay? So the elbow is 3 bones, the humerus, the radius, and the ulna. And that's important. That's important. The forearm. The forearm consists of 2 bones, the ulna and the radius. The radius is the medial bone and is parallel to the lateral bone, which is the ulna. And in between these 2 bones is an interosseous membrane, that connects both bones. The ulna, the medial bone of the forearm. Okay? This is an important word, the olecranon. The olecranon is actually the posterior portion of the ulna. It is your elbow. This is the elbow bone that you touch. So the ulna produces the olecranon. Okay? I want you to know that the ulna is the medial bone. I think I said wrongly that the radius was, but in the anatomical position, the medial bone of the forearm is the ulna, because when you're in the anatomical position, it's like this. So the radius is lateral and the ulna is medial. This is a word I want you to know, the olecranon, part of the ulna. The radius. The radius is the lateral bone of the forearm. And basically, that's all I want you to know about the radius, especially at the elbow. Especially at the elbow. Okay? Here's the interosseous membrane. Here is the olecranon, part of the ulna. So know those words. A very common fracture in children and also adults is known as a Colles fracture. Colles fracture is a break of the distal radius. When we say distal radius, that means it's near the wrist. A very common fracture in people that have a Foosh injury, F-O-O-S-H, falling on outstretched arms. Okay, F-O-O-S-H, a very common injury in people that fall and put their arms out to catch their fall. So if you're going to fall, tuck your arms inside. Just fall on your shoulder. Don't fall on your outstretched arm. You'll break your wrist. Now we get to the hand. The bones of the hand include the carpus, which is your true wrist, the metacarpus, which is your knuckles, and the phalanges, which are your fingers. The carpus, otherwise known as the wrist, has 8 bones. 8 bones. You don't have to know the names of the bones because you're not in medical school or nursing school yet. But if you go to nursing school and medical school, you have to know these bones. Okay? The scaphoid, the lunate, the triquetrum, the pisiform, the trapezium, the trapezoid, the capitate, and the hamate. I'm not going to ask you questions on individual bones. Know that the carpus has 8 bones, and there are 2 rows of them, a proximal row and a distal row. If you're going to go to medical school or become a PA or become a doctor, you'll have to know these 8 bones. And the easy way to know them is this. Some lovers try positions that they cannot handle. That's how we learn the 8 bones of the wrist. The metacarpal, otherwise known as your palm or your knuckles, Obviously, there are 5 of them, 5 bones. And they connect to the fingers, otherwise known as digits. And you know the word pollex, that is your thumb. The pollex has 2 bones, no middle phalanx. The other 4 bones have 3 bones, a distal, a middle, and a proximal phalanx. Here you go. Here are the 8 bones of the wrist. Some lovers try positions that they cannot handle. Then you have the metacarpals. The metacarpals. All right? And then these are the metacarpals. And then you have the phalanges. And as you can see, the thumb or the pollex only has 2 bones in the phalanges, where all the other phalanges have 3 bones. Another reason to understand this is because there are nerves that run through your wrist. And if you overuse your wrist, say you're a typist or you're a mechanic, and you overuse your wrist, you inflame the tendons of your wrist, and these will then compress the median nerve. And the median nerve will give you tingling and numbness of your hand. And this is called carpal tunnel syndrome. And the way to cure that is to operate and loosen these tendons so that the median nerve is no longer compressed. All right, let's drop down into the hip. The hip girdle, otherwise known as the pelvic girdle, is formed by 2 bones, the coccyx bone and the sacrum. Obviously, this joint is to attach your lower limbs to the axial skeleton. It is a weight-bearing joint, a weight-bearing joint. It has less mobility than the shoulder, but is much more stable. The coxal bone consists basically of 3 fused bones: the ilium, the ischium, and the pubis. Like the shoulder bone and the shoulder girdle, it also has a deep socket. The deep socket of the pelvic girdle is called the acetabulum, and it is there because it accepts the head of the femur to form the hip joint. So in the shoulder, you have the glenoid cavity, which accepts the humerus, and in the pelvic girdle, you have the acetabulum, which is a cavity in which the head of the femur sits. That's your hip joint. Here is the ilium. This is your hip. Here is your ischium. And here is your pubis. The 3 fused bones of the hip. Here they are. Here is the acetabulum. This is where the head of the femur sits, right here. Okay, right here. The ilium. The ilium is the superior part of the coccyx. It articulates with the sacrum to form the sacroiliac joint. The ischium. The ischium is the posterior inferior part of the hip bone. You're sitting on it right now. There is a tuberosity of the bone called the ischial tuberosity, is what you're sitting on right now. You're sitting on the ischial tuberosity. And then you have the pubic bone, which is the anterior bone, which joins both bones of the pubis to form the pubic symphysis joint. So you have the ilium, which is the upper part, the posterior inferior, which is the ischium, and then the anterior portion of the hip is the pubis. Okay? basically, that's all I really want you to know about the hip bone. Here is the ischial tuberosity. Here it is. That's what you're sitting on, the ischial tuberosity. The pubis. The pubis is the anterior portion of the hip bone. It houses the largest foramen or opening in the body. Okay? It is known as the obturator foramen. This is the largest opening in the body. Through this opening, you'll learn in the nervous system, when we get to it next, is where the sciatic nerve goes through. The largest opening in the body. You know I'm going to ask you a question on the obturator foramen. It is part of the pubic bone. Here it is, the obturator foramen right here. And this is the pubis bone right here. Okay? This is what you're sitting on, the ischial tuberosity. The three bones of the hip. I'm not going to ask you any questions on the difference between the male and female pelvis. It's not really important for our discussion. So we'll now drop into the lower limb. The lower limb carries the entire weight of your body when you're standing. It is subject to many forces, running and jumping. It has three segments. The upper portion is the thigh. The lower portion or the middle portion is the leg, and the lower portion is the foot. The thigh. The femur is the biggest, largest, and strongest bone in the body. It articulates with the acetabulum proximally to make the hip, and distally with the tibia and patella of the knee. The patella. The patella is the largest sesamoid bone in the body. It sits in the quadriceps tendon. Its function is to protect the knee joint. So know the femur is the biggest and the patella is the largest sesamoid bone in the body. You don't have to know the parts of the femur or the thigh. That's not important. Just know where it attaches. Know where it attaches. You're not going to remember any of this anyway. Don't worry about all this other bold letters. Okay? Here is where the femur attaches to the acetabulum. It's called the head of the femur. The head of the femur. Okay? There is a neck, and this is important because this is where you fracture your femur, in the neck. In the neck. You also fracture your femur here, in between the greater trochanter and the lesser trochanter. So most fractures of the femur are either in the neck or in the inner trochanteric line between the greater trochanter and the lesser trochanter. Okay? So that's important. What's also important, and it's not really talked about, if you fracture your femur here, you have to remember this bone is the largest bone in your body. It has an enormous blood supply. If you broke your femur, you're going to lose a pint or two of blood. If you broke both your femurs, you could bleed to death. You could bleed to death. Okay? So that's important. That's very, very important. Here is the patella. It is the largest sesamoid bone in the body, and it protects your kneecap. This shows you the hip joint. The head of the femur is in the acetabulum. Okay? This is the proximal joint of the femur. The distal joint is the knee, right here, right here. All right? Here is the knee. Here is the knee. All right? We'll talk about these bones. The leg. When we talk about the leg, we talk about from the knee to the ankle. From the knee to the ankle. Just like the lower arm or the forearm, it is made up of two parallel bones, the tibia and the fibula. The lateral bone is the fibula. The medial bone is the tibia. It is connected, just like in the forearm, with a membrane, an interosseous membrane. Okay? The big bone of the lower leg is the tibia. It is the medial bone. The fibula is the lateral bone and is a non-weight bearing bone. It has no articulation with the femur, none whatsoever. Okay? It articulates proximally and distally with the tibia, but not with the femur. There are a few words that I do want you to know about the tibia and the fibula, and here is what I want you to know. I want you to know that since the tibia is the medial bone of the leg, at the ankle, it forms the medial malleolus. The word malleolus in Latin means ankle. So the medial bone of the ankle is the tibia, the medial malleolus. The lateral bone of the ankle is the fibula, the lateral malleolus. And the reason I want you to know that is because of this X-ray. This is the lateral malleolus. This is the medial malleolus. What we have here is a bimalleolar fracture. That means that both bones of the ankle are broken, okay? The lateral malleolus and the medial malleolus. So know those terms. Know that they are at the ankle of the leg. The other word I want you to know is on the tibia, and this is the tibial tuberosity, otherwise known as your shin bone. Okay? The tibial tuberosity, the outpouching of this bone is known as your shin bone, right here. Tibial tuberosity. Okay? And the reason I talk about the bimalleolar fracture because it's a common sports injury, a very common sports injury. Both bones of the distal ends of both the tibia and fibula are broken. All right? The foot. The foot consists of the ankle, which is the tarsus, the metatarsal bones, and the phalanges. I don't really care if you know that the tarsal bones are 7. I want you to know the word tarsus means ankle. That's what I want you to know. And I want you to know that there are 2 weight-bearing bones in the ankle, and they are the talus, which is anterior, and the calcaneus, which is posterior. This calcaneus bone is your heel bone. So note that the ankle consists of an anterior bone, the talus, and a posterior bone, the calcaneus, otherwise known as your heel bone. You don't have to know the other tarsal bones. That's not important. Just like in the hand, except for metacarpals, we have 5 metatarsals, 1 through 5. The hallux is your big toe. As in the hand, there are phalanges, which are your toes. The hallux is the great toe, which has 2 bones, no middle phalanx, and the other bones have 3 bones, distal, middle, and proximal phalanges. Here they are. Here's your posterior calcaneus, otherwise known as your heel. Here is the weight-bearing anterior portion of your ankle called the talus. Then you have the metatarsals. Here are your metatarsals. And then you have the bones of your phalanges. Here is a nice picture of your heel bone. Here's a nice picture of your talus. Do not worry about the arches of your foot. I'm not going to ask you any questions on the arches of your foot. Not important. I think we just finished. Let me unrecord